Ever imagine yourself like actually shaping healthcare for your community,
Hmm.
making the kind of decisions that could impact so many people's lives?
Yeah.
That's the power of being a public health policy officer. You've been curious about this career path, and we're going to dive deep into RoleCatcher's insights to really see if it's the right fit for you.
It's a demanding career path,
Right.
but it's also incredibly rewarding. It's about so much more than just understanding healthcare. It's about
Mm.
crafting policies and systems that create a healthier future.
Yeah, RoleCatcher really does a great job of painting that picture
Yeah.
of what these architects of well-being actually do.
Mm.
They analyze these healthcare systems from top to bottom. They pinpoint those areas that really need a boost,
Yeah,
and then they rally everyone together to actually make those improvements happen.
exactly.
And it's not just about like crunching numbers in an office somewhere.
Absolutely not a great example is how they might analyze the impact of a new policy on rural communities. So
Yeah.
looking at things like, do people have better access to specialists? Are those preventative services actually reaching the people who need them most?
Mm-mm.
That's the kind of real-world impact that we're talking about here.
So it's really about kind of translating that data into action, right?
Yeah,
Bridging that gap between research and the people that it's meant to help.
exactly.
And with telemedicine and electronic health records kind of changing how healthcare is delivered, this work is more important than ever.
Absolutely. Those advancements, they create a whole new set of challenges and opportunities.
Hmm.
And it's the public health policy officer who helps to navigate those complexities.
So how do you navigate those choppy waters? I mean, let's be real. No job is perfect.
Right.
And RoleCatcher doesn't shy away from the tough parts.
Yeah.
What are some hurdles someone might face in this field?
Well, you have to imagine trying to, get a new health initiative funded
Right.
when the budget's tight, or dealing with so many different opinions from stakeholders with their own priorities.
Yeah.
Those are the kind of challenges you'll need to be prepared for.
So you need resilience
Yes,
and some serious diplomacy skills.
absolutely.
Hmm.
But RoleCatcher also highlights this incredible sense of purpose that comes with this career.
Hmm.
You're not just clocking in and out. You're contributing to something so much bigger than yourself.
It's bigger than all of us.
Exactly. And that passion is what fuels you through the long hours and those deadlines that often come with the territory.
Yeah.
So you have to weigh those rewards against those challenges and ask yourself, is this a good fit for who I am and what I value?
It's a big question.
It is a big
It's a
question.
million-dollar question. So let's say someone is listening right now and they're thinking, this is it.
Hmm.
This is the path for me. What does RoleCatcher say about how to actually get started? What are the building blocks to becoming a public health policy officer?
Well, first and foremost, education is paramount.
Yeah.
You need that strong academic foundation to really excel in this field.
Oh,
Now, you might think that a public health or health policy degree is the only way to go.
right. It seems like the obvious answer.
Right. But it's not so cut and dry.
Really? Tell me more about that.
Degrees in fields like economics, sociology, even political science can provide surprisingly relevant skills. Take social determinants of health, for example, understanding how factors like poverty or access to education impact well-being.
Right.
That's crucial for developing those effective policies.
It's like connecting those dots to see the bigger picture of health.
Exactly.
So you've got your education, but what about those skills that really make a public health policy officer stand out from the crowd? What do you need beyond the textbooks?
Well, strong analytical abilities are a must-have. You're going to be digging into that data, interpreting trends, and using that information to inform your recommendations.
So you've got to be comfortable with spreadsheets and research?
Absolutely.
Yeah.
But don't underestimate the power of strong communication skills,
So absolutely.
both written and verbal.
Because you're dealing with people.
Exactly. Imagine having to explain a complex policy change to a room full of skeptical stakeholders.
It's a tough crowd.
Right. You need to be able to get your point across clearly and persuasively, no matter who you're talking to. And that's something that RoleCatcher highlights as a surprisingly essential skill persuasion.
Persuasion. That's not something you typically associate with public health.
You'd be surprised.
Yeah.
As a public health policy officer, you're constantly advocating for change.
Interesting.
Whether you're presenting research or pushing for new legislation, you need to get people on board with your vision for a healthier community.
So you've got the education you're working on, those essential skills, but what about practical experience? How do you convince those potential employers that you're ready to hit the ground running?
That's where things get really interesting. RoleCatcher is adamant about the importance of hands-on experience.
Okay.
We're talking internships, entry-level positions, anything that gives you a taste of what it's like to actually work in public health policy.
So getting your feet wet, showing them you're not all talk.
Exactly. And look for those opportunities where you can have a tangible impact, even if it's a small one.
Hmm.
Did you help analyze a local health initiative? Did you contribute to a report that influenced policy changes?
Mm,
Those experiences are gold on your resume.
they really are. So it's demonstrating initiative, passion, a willingness to learn. And speaking of learning, RoleCatcher really stresses continuous professional development.
Yes.
It's not just about getting that degree and calling it a day.
Not at all. Public health is constantly evolving, so you need to stay ahead of the curve. That means pursuing certifications like Certified in Public Health, CPH,
Yeah.
or Health Education Specialist, CHES, to really showcase your expertise.
Yeah, so it's like getting that stamp of approval, that extra edge in a competitive job market.
Absolutely. It shows potential employers that you're serious about your career and committed to staying current with all the latest developments in public health.
It's like leveling up your knowledge and skills to become a true leader in the field. And those certifications can really help open doors to leadership roles and even more specialized areas of public health policy.
Exactly.
Now, I'm curious about something you mentioned earlier. RoleCatcher talks about these different career stages for a public health policy officer.
hmm
Why is that breakdown so important for someone to understand?
Well, it's easy to think of a career path as this straight line,
Right.
but the reality is it's much more dynamic.
Yeah.
RoleCatcher really breaks it down into these distinct phases,
Right.
from entry level all the way up to those senior leadership positions.
Yeah.
And they don't just tell you what each stage looks like.
Right.
They give you real-world examples of individuals at those different points in their journey.
So you can really see how someone starting out might progress over time.
Exactly.
That's got to be incredibly helpful for someone who's just starting to explore this career.
Absolutely. Let's say you land that entry-level role right out of college. You're probably assisting senior staff with research, maybe helping to analyze the effectiveness of those existing programs.
Getting your hands dirty with the data.
Exactly. But as you gain experience and you move into a junior level position,
Mm-hmm.
you might take on more responsibility for those specific projects.
Mm-hmm.
Maybe you're leading the analysis for a new health initiative, or you're presenting those findings to stakeholders.
So the stakes get a little higher,
Yeah.
but you're also gaining that valuable experience and
Sure.
building your expertise.
And that's what's so great about this career path. There's always room to grow and take on new challenges.
So what comes next? What does that mid-career stage look like?
This is where those leadership skills really become crucial.
Okay.
You might be managing a team, developing policy recommendations, or even advocating for those policies in front of government officials.
Wow, so you're really starting to have a direct impact on shaping public health at that point.
Absolutely.
That's amazing.
And as you reach those senior levels, you become a recognized expert in your field. You're the one advising on those major policy decisions, and you're mentoring the next generation of public health leaders.
That's incredible to think about. From analyzing that data to leading those national health initiatives, it's amazing how far you can go.
It really is. And RoleCatcher doesn't just stop at describing those career stages. They go a step further by providing those resources and tools to help you actually reach your goals.
You mean things like interview prep and networking tips?
Exactly.
Yeah.
They have this massive library of practice interview questions specifically tailored for those public health policy roles.
Wow.
You can even record yourself answering those questions and get feedback on your performance.
Wait a minute, are you telling me they have AI that can analyze your interview skills?
They do. It's called RoleCatcher Copilot AI, and it can provide incredibly detailed feedback on everything from your body language to the actual content of your answers.
That's pretty wild. It's like having a personal interview coach in your pocket.
It really is.
Yeah.
And on top of that,
There's more.
they have tools to help you build your professional network, connect with potential mentors, and even just discover job openings that really align with your career aspirations.
So RoleCatcher's like this comprehensive career companion, guiding you every step of the way.
Precisely. They understand that finding a fulfilling career is about so much more than just landing a job.
Yeah.
It's about aligning your passion with your skills and really making a difference in the world.
And speaking of making a difference, something that really stood out to me from RoleCatcher was their emphasis on advocating for yourself in your career growth.
Yes, it's so important, especially in a field like public health policy, where your voice and your expertise are your greatest assets.
So it's not just about advocating for the health of the community, it's
Yeah.
about advocating for your own professional development.
Exactly. RoleCatcher really encourages you to be proactive.
Okay.
Don't be afraid to seek out those new opportunities. Raise your hand for those challenging projects, and just never stop learning and growing.
It's about taking ownership of your career path and not being afraid to ask for what you want.
Precisely.
Yeah.
And don't underestimate the power of showcasing your accomplishments.
How do you mean?
Whether it's publishing your research findings, presenting at conferences, or even just sharing those insights on social media,
Yeah.
putting yourself out there can lead to those unexpected opportunities.
So it's not just about doing the work,
Uh,
it's about letting the world know about the amazing things that you're accomplishing.
Exactly.
Yeah.
And RoleCatcher provides a platform for doing just that.
That's fantastic. Now, we've been talking a lot about RoleCatcher's resources,
Yeah.
but I'd love to hear more about your personal experiences in public health policy.
Sure.
What are some of the things that maybe surprised you about this field when you first started out?
You know, one thing that surprised me early on was just how collaborative this field really is.
Collaborative. Tell me more about that.
It's easy to imagine a public health policy officer as this lone wolf,
Right.
crunching numbers, writing reports in isolation.
Hmm.
But the reality is you're constantly working with others.
Okay, so teamwork is crucial.
Absolutely.
Yeah.
You're collaborating with other researchers, healthcare professionals, community leaders,
Yeah.
even policymakers.
Wow, that's a lot of people.
It's about bringing all of those different perspectives together to find those solutions that really work for everyone.
That makes sense. These public health issues are complex,
Yeah,
and there's no way one person could have all the answers.
exactly. And that's what makes this field so stimulating.
Yeah.
You're constantly learning from others and really challenging your own assumptions.
It's like a constant brainstorming session
Mm-hmm.
where everyone is working towards that same common goal of improving public health.
That's a great way to put it.
Now, we touched on this a little bit earlier,
Yeah.
but I think it's worth diving a little deeper.
Okay.
How has technology impacted the work of a public health policy officer?
I mean, it's been a game changer. From electronic health records to those wearable fitness trackers,
Right.
we have access to more health data than ever before.
And that data can be incredibly valuable for tracking those disease outbreaks,
Yes.
identifying those health trends, and just developing those more effective interventions.
Exactly. But it also raises a whole host of ethical considerations.
Like data privacy and security.
Absolutely.
Yeah.
As a public health policy officer, you need to be mindful of those issues and ensure that data is being used responsibly and ethically.
It's a delicate balance, isn't it?
Yeah,
Between harnessing that power of technology
right.
while also protecting those individual rights and privacy.
Precisely. And that's something that RoleCatcher addresses in their career guide.
They do. That's great. What kind of insights do they provide?
Well, they have a whole section that's dedicated to the ethical implications of technology in public health.
Okay.
They talk about the importance of informed consent, data security, and ensuring that equitable access to technology.
So they're not just throwing you into the deep end without any guidance.
Not at all. They recognize that navigating those ethical complexities is such an essential part of being a responsible and effective public health policy officer.
And speaking of responsibility,
Yeah.
what are some of the other challenges that public health policy officers are really grappling with today?
Well, one of the biggest challenges and opportunities is the growing focus on health equity.
Right. Making sure that everyone, regardless of their background or where they live, has the opportunity to live a long and healthy life.
Exactly.
Yeah.
And that means really addressing those systemic barriers to care,
Which are?
like poverty discrimination,
Yeah.
and that lack of access to quality health care.
It's about recognizing that health is influenced by so much more than just our individual choices.
Absolutely. Factors like your education, your
Mhm.
income, even where you live, can have such a profound impact on your health outcomes.
And addressing those social determinants of health requires a multifaceted approach.
Exactly. It's not enough to just focus on individual behavior change.
Right.
We need to create communities and systems that really support health and well-being for everyone.
And that's a huge part of what public health policy officers do.
It is. They're working to create those policies that promote health equity and ensure that everyone has that opportunity to achieve their full health potential.
That's really inspiring.
It is. It's one of the things I find most rewarding about this field.
Me too. Now, we've covered a lot of ground here,
We have.
but I don't want to run out of time before we talk about one of the most important parts of any job search,
Which is?
the interview.
Ah, yes, the interview.
RoleCatcher seems to really excel in this area.
They do.
Can you tell me more about those interview prep resources?
Absolutely. They have this incredible database of over 120,000 interview questions covering a wide range of industries and job titles.
120,000. That's incredible. How do you even begin to navigate that many questions?
Well, they're all neatly organized by category and skill set,
Okay,
so you can easily find those questions that are relevant to your desired role.
that makes sense. So if I'm applying for that public health policy officer position, I can focus on questions that are specific to that field.
Exactly. And it's not just about having access to the questions.
Right.
RoleCatcher actually provides insights into what those interviewers are really looking for in a response. They even offer those sample answers that you can use as inspiration.
So it's like having a sneak peek into the interviewer's mind.
Precisely. They also have this really cool feature called video practice, where you can record yourself answering those interview questions
Oh, wow.
and watch it back later.
That's a game changer for so many people. Being able to see yourself as the interviewer sees you
Yes.
can be incredibly helpful for identifying those nervous hepatics or those areas where you need to improve.
Absolutely. And for those who want that extra edge, they offer a premium subscription called RoleCatcher Copilot AI
Okay.
that provides AI-driven feedback on your video practice sessions.
Wait, are you telling me the AI will actually watch your practice interviews and give you notes?
It does. It analyzes your body language,
Yeah.
your tone of voice, even the content of your answers, and provides that personalized feedback on how to improve.
That's next level interview prep.
It is.
It's like having a personal coach and a talent agent all rolled into one.
Exactly. And the best part is all of this, the job board integration, the skills analysis,
Yeah.
the interview practice, it's all designed to help you present your most authentic, confident, and capable self to those potential employers.
It's about showcasing your passion for public health,
Yeah.
your unique skills and experience,
Mm-hmm.
and ultimately landing your dream job.
Precisely.
It's like RoleCatcher is that secret weapon you need,
Uh-huh.
helping you put your best foot forward every step of the way.
Absolutely. Equipping you with those tools and confidence to really shine in those critical moments.
Now, let's say someone listening has just sailed through that interview process.
Right.
Thanks to RoleCatcher's awesome prep resources, they've landed their dream job as a public health policy officer.
Amazing.
What does RoleCatcher say about navigating those first few months in a brand new role?
Well, it can definitely feel like a whole new world. But RoleCatcher really emphasizes the importance of being a sponge, just soaking up all that information you can.
I love that.
Ask those questions. Observe your colleagues. And don't be afraid to volunteer for new projects.
Prove yourself. Show them you're ready to learn and contribute.
Exactly. And don't underestimate the power of building relationships with those colleagues. Public health is so collaborative, and having that strong network of support makes all the difference.
It's like building your own personal board of advisors.
Exactly.
People you can go to for anything.
Absolutely. And as you start gaining experience, don't be afraid to advocate for your own development.
Right.
Seek out those opportunities to expand take on those new challenges and make sure your voice is heard.
Because it's about so much more than just climbing the ladder. It's about making a real difference.
Exactly. And that brings me to something I find truly inspiring about this field.
What's that?
The passion and the dedication of the people who work in it. Every day I'm surrounded by people who are driven by this deep desire to make a positive impact on the health of their communities and the world.
Yeah, it's that commitment to something bigger than themselves that really sets public health professionals apart.
They're not in it for the glory or the big paychecks.
Yeah.
They're in it to make a real tangible difference.
And that's what I hope our listeners are taking away from this deep dive.
Yeah.
That a career in public health policy, it's not just a job, it's a calling.
It is.
It's an opportunity to use your skills, your knowledge, your voice to advocate for a healthier and more equitable future for everyone.
Couldn't agree more.
It's about being a champion for change.
Yeah.
A voice for those who aren't being heard.
Right.
And a driving force for a better tomorrow. What could be more rewarding than that?
Nothing at all.
Yeah.
It really is an honor and a privilege to work in this field, and I encourage anyone listening who has that passion for public health to explore the incredible opportunities out there.
And with RoleCatcher as your guide,
Yes.
you'll have the tools, the resources, the confidence to turn that passion into a truly impactful career. So to all our listeners out there, remember this. The future of public health,
Yeah.
it's in your hands. What will you do with that power?
Now, that is a question worth pondering.
It really is. And on that note, we'll wrap up this deep dive into the world of public health policy officers. A huge thank you to our expert for sharing their incredible
It
insights.
is my pleasure.
And to all of you for joining us on this journey. Until next time, stay curious, stay informed, and stay engaged.
Love that.
The world needs more passionate individuals like you to shape a healthier future for everyone.